Dangers of dehydration. Dehydration is a condition that occurs when the body loses more fluids than it can take in. Fluids are essential for many bodily functions, including regulating body temperature, transporting nutrients and oxygen to cells, and removing waste products. When the body becomes dehydrated, it can't function properly. Dehydration can be caused by several factors, including excessive sweating due to exercise, hot weather, or fever, vomiting or diarrhea, not drinking enough fluids, certain medical conditions such as diabetes and kidney disease. Mild dehydration can cause symptoms such as thirst, dry mouth, headache, and fatigue. Moderate to severe dehydration can cause more serious symptoms, such as dizziness, confusion, rapid heartbeat, and low blood pressure. In severe cases, dehydration can lead to seizures, coma, and even death. Dangers of dehydration. Dehydration can have several negative health consequences, including heat exhaustion and heat stroke. Heat exhaustion and heat stroke are two serious conditions that can occur when the body becomes too hot. Dehydration can make it more difficult for the body to regulate its temperature, increasing the risk of heat exhaustion and heat stroke. Kidney stones. Dehydration increases the risk of kidney stones by causing the urine to become more concentrated. Urinary tract infection. Dehydration can also increase the risk of urinary tract infection by making it more difficult for the body to flush out bacteria. Constipation. Dehydration can also lead to constipation by making the stool harder and more difficult to pass. Cognitive impairment. Dehydration can also impair cognitive functions, leading to difficulty concentrating, remembering things, and making decisions. Seizures and coma. In severe cases, dehydration can lead to seizures and coma. Dehydration in children and older adults. Children and older adults are at an increased risk of dehydration. This is because children have smaller bodies and can lose fluids more quickly. Older adults are also more likely to have medical conditions that can increase the risk of dehydration, such as diabetes or kidney disease. It is important to seek medical attention if you have any of the following symptoms of dehydration: severe thirst, dry mouth and tongue, little or no urination, dark yellow or amber urine, dizziness or lightheadedness, confusion, rapid heartbeat, rapid breathing, sunken eyes, fatigue or weakness, seizures. How to recover from dehydration. The best way to recover from dehydration is to drink plenty of fluids. If you have mild dehydration, you can usually rehydrate by drinking water, clear broths, or sports drinks. If you have moderate to severe dehydration, you may need to be treated with intravenous fluids in a hospital. To prevent dehydration. The best way to prevent dehydration is to drink plenty of fluids throughout the day. You should drink even more fluids if you're sweating a lot, vomiting, or having diarrhea, or living in a hot climate. Here are some tips for staying hydrated. Drink water before, during, and after exercise. Drink fluids throughout the day, even if you don't feel thirsty. Eat fruits and vegetables which are high in water content. Avoid sugary drinks such as soda and juices, as they can dehydrate you. If you're vomiting or having diarrhea, drink clear broths or sports drinks to replenish your fluids and electrolytes. If you have a medical condition that increases your risk of dehydration, such as diabetes or kidney disease, talk to your doctor about how to stay hydrated. Proper hydration is essential for everyone, but it is especially important for seniors. As we age, our bodies become less efficient at regulating temperature and fluid balance. We also tend to have a diminished sense of thirst. As a result, seniors are at an increased risk of dehydration. Dehydration can have severe negative health consequences for seniors, including falls and fractures. Dehydration can lead to dizziness, confusion, and lightheadedness, which can increase the risk of falls and fractures. Kidney stones and urinary tract infections. Dehydration can increase the risk of kidney stones and urinary tract infections, which can be especially serious for seniors. Constipation. Dehydration can also lead to constipation, which can be uncomfortable and painful. Cognitive impairment. Dehydration can also impair cognitive function, leading to difficulty concentrating, remembering things, and making decisions. Increased risk of hospitalization and death. Studies have shown that dehydration is associated with an increased risk of hospitalization and death in seniors. How to help seniors stay hydrated. There are several things that caregivers can do to help seniors stay hydrated. Make sure that seniors always have access to fluids. Keep a pitcher of water or other fluid on the bedside table and in other shared areas. Offer seniors fluids frequently, even if they don't say they're thirsty. Make fluids more appealing by adding slices of fruit or vegetable, or by serving them cold or at room temperature. Encourage seniors to eat fruits and vegetables which are high in water content. Avoid sugary drinks such as soda and juice, as they can dehydrate. If a senior is vomiting or having diarrhea, give them clear broth or sports drinks to replenish their fluids and electrolytes. If you are concerned that a senior you care for is not staying hydrated, talk to their doctor. They can assess the senior's hydration status and offer recommendations on how to keep them hydrated. Here are some tips for seniors to stay hydrated. Drink plenty of fluids throughout the day, even if you don't feel thirsty. Aim to drink 8 to 10 glasses of water per day. Pay attention to your thirst signals. Don't wait until you are thirsty to drink fluids. If you're taking any medications that can cause dehydration, such as diuretics, talk to your doctor about how to stay hydrated. By staying hydrated, seniors can reduce their risk of severe health problems and improve their overall health and well-being. I put this together because I just went through this, and I can tell you it wasn't any fun. I wasn't sure what was wrong with me. I thought that I had a UTI, or possibly another case of COVID, or maybe the flu. A visit to the doctor and many tests ruled out all those hunches and clearly showed that I was dehydrated, even though I was never thirsty. Lesson learned. Water is now a new friend, and I'm back on the mend. Stay safe, stay secure, and above all, stay hydrated. I'll see you again soon. Bye-bye, and thanks for watching and listening.